critical they are to the safety of our communities, and we continue to see that day in and day out. And there's a number. There's at least 150,000 other items that one individual in the state would like for us to add, and they've called and asked us to. And obviously, we're taking some of those requests more seriously than others, but we're looking at every single one of them.
Governor, I wanted to get your reaction to Texas Governor Abbott issuing an executive order banning vaccine mandates by private entities. Is that something that we could see here in Mississippi?
Well, there's a number of possibilities that exist. Certainly, I have been reluctant to issue executive orders throughout this entire pandemic. Doesn't mean I haven't done it, and there have been times that I have. One of the items that I spoke with some legislators about earlier is, executive order is one way in which to rid ourselves of these mandates. Another potential is legislation. That's one of the things that Florida did, for instance, as a state, is their legislature passed a law which said these vaccine mandates were not allowable. I would support such legislation should it get to my desk. But look, let's take a step back, and you've got the logistics and the specifics of executive orders, potential state laws that I may sign, bills that may pass the legislature. But let's just take a step back and understand how bad this policy is for America and how bad this policy is for Mississippi. A couple of examples. The reason Governor Abbott and many state legislatures have passed prohibitions against these mandates is because of the data that we see coming out. There was a report earlier today in August. We had 4.3 million Americans quit their job. 4.3 million Americans. Today on Tuesday, we only have to look over the last 72 hours at what's happened at Southwest Airlines, where literally hundreds and hundreds of flights around the country have been grounded. You look at what's going on in our supply chain, in the supply chain issues that we have in America today. Our economy is slowing in large part because of those supply chain issues. You go to the Port of Los Angeles, for instance, and I understand there are literally ships lined up to get into the port and unload the goods that are coming from all over the world into America, but they can't get them unloaded, in large part because of the policies that have been adopted in the state of California. And so, again, I just think it's really important to stress how these mandates are bad for the American economy, and they're bad for Mississippi's economy. One of the challenges that we have now, and we've seen it, and we've had to go out and literally spend millions and millions of dollars supplementing the workforce and the workforces at our hospitals. Well, there is no doubt that any of these healthcare facilities that decide to try to mandate vaccines, it's going to exacerbate their workforce problems. We need to be looking at ways to eliminate their workforce problems, not exacerbate their workforce problems. And that's why you will see me looking at and talking a lot about the potential of adding through our State Workforce Investment Board and Ryan Miller and his team. We had a press conference here a week or two ago in which we talked about categorizing all of the healthcare workers that we have in the state, all of the healthcare worker needs that we have in our state, and developing a plan to have more Mississippians go into the healthcare space because we know they're going to have jobs tomorrow. We started this process literally years ago. We invested $67 million in a new medical school on the campus of the University of Mississippi Medical Center. That allowed us to increase the number of docs that they allow in, or first-year medical students that they allow in, from approximately 100 to over 150. That's a 50% increase in number of docs that can come out on an annual basis. We invested $28 million in a new nursing school on the campus of the University of Southern Mississippi. And again, Those are great booms to the construction phases on those university campuses, which is good. But more importantly, the reason we invest in those is because we know that every single one of those students that comes out, they get a job. And so that's something that we have to continue to invest in and focus on. Yes, ma'am.
Hunter Dawkins with the Gazebo Gazette has a question.
Good.
Thank you, Billy. Thank you, Governor. Governor, I apologize for being on an old computer that I missed it. Was I cut off when you were discussing the day extent? The 30-day extension didn't have any, mask mandates or anything like that on it. But it's a little bit awkward when you were telling me about the numbers, or when you were the audience about the numbers and how we're reducing. But what's the avenue that we're looking for the extension? Are we just doing this to try to receive more federal money? Kind of give me your thoughts, please. Thank you, Governor.
Thank you, Hunter, and I'll forgive you for being on an old computer. But so I'm just going to quickly go through what I mentioned earlier. The reasons for the extension are the additional tools in the toolbox that it allows for us. It gives Dr. Dobbs the ability to do a number of different things in his response to the pandemic. It also allows for us to have continued access to the Mississippi National Guard should we need them for the pandemic response. It also allows for the expanded telemedicine order that has been in effect since the beginning of the pandemic. There are many Mississippians that have received very good, adequate health care services, including, but not limited to, mental health services over a computer or over their telephone, telemedicine services. It allows that to continue, as well as a few other items that are helpful. It does not include any additional mandates, nor does it include any additional restrictions.
Bobby Harrison has a question.
Yeah, Governor, I think I was on the same computer with Connor as far as coming in and out. But real quickly, is there any scenario, you feel confident that there will be a special session, those final details be worked out? And second, do you anticipate, talked about maybe adding some additional things to the special session, do you anticipate trying to work on a plan to spend $1.8 billion in federal funds? Thank you for taking my question.
Yeah, well, thank you for the questions, and I am confident that we will have a special session of the legislature if we get an agreement on the specifics of a couple of items that are left outstanding. Again, we've made great progress. We've worked very closely with our legislative leaders and hope to continue to do so. And if we are able to get that done and we can pass a medical marijuana program and do it right, then we will have a special session as soon as that gets done. With respect to the monies that have come to the state, we've received approximately $900 million that we've distributed and allocated out per the federal law to our cities and counties. They have already received that nearly $1 billion, and we administered that through the State Department of Finance and Administration, and many of those projects have already been funded. There are certainly a lot of conversations. We met recently with legislative leaders on what the state spending will look like, and I think we're going to continue to have those conversations. I don't know that that would be included in the special session. We'll just have to see exactly the timing on that. But I do think you'll see fairly significant movement over the next, obviously, 4 to 5 months at a minimum when the legislature gets in early January.
Governor, related to that, there was kind of a piecemeal request for part of that money that Speaker Gunn and others want to spend to provide bonuses, as it were, for some healthcare workers. Is that under consideration for a special session?
Emily, I would say everything's under consideration. I asked Lieutenant Governor Hoseman, I think it was his idea, I asked him to get us draft legislation as to exactly what that would look like, and we are reviewing that as we speak. I will tell you that we are very interested in developing a plan to deal with the long-term challenges in the healthcare arena and healthcare shortages. I will tell you that much of the loss of staffing at the hospital level over the last 30 to 60 days, I think, has been driven by some of these vaccine mandates that are being required at certain facilities, not all, but at certain facilities. I saw in the state of New York there was one hospital that literally laid off 2,000 or 3,000 employees. It's hard for common folks like me to understand how we have this major shortage, yet you're laying off major numbers of your staff. So again, we're looking at that, and everything's under consideration, but we've got a ways to go on that one.
Are you getting the vaccine booster, Governor?
I don't know that I'm old enough to get it yet, but if Dr. Dobbs, who has been advising me from the beginning on all things COVID, advises that I get it, then I'll certainly take his advice. Yes, sir.
I know wait times was a major factor in the Skip the Line program. Can you talk about how much COVID-19 was a factor in getting that done?
Yeah, so if you go back to 2018, 2019, wait times were a major issue before COVID. When we made the decision to limit the amount of human interaction in March and April of 2020, because at that time we just really didn't know what we didn't know. There's no doubt that the driver services bureaus, having been shut down for a couple of months, took what was already a bad situation and made it a lot worse. And so, because as we came back online after being shut down for 8 weeks, obviously you had a large number of people that probably would have had to wait in line longer than they wanted to if we had not closed to the public the driver services bureaus, but they had to wait even longer there in early June through July. Seeing no other questions, I want to thank everyone for being here. Y'all have a great afternoon. Thank you. And I want to particularly thank these guys here, Commissioner Tyndall and Keith. They have just done a phenomenal job doing exactly what I said in my original speech upon being sworn in as governor. It is not our goal to hide our problems. It is not our goal to hide our challenges. Our goal is to fix them. And these two gentlemen up here have led the way at the Department of Public Safety, and I appreciate their efforts. Thank you all.